The first U.S. Ebola patient died today, and now a Dallas County Sheriff's deputy who went into the apartment of the Ebola patient has been hospitalized after getting sick. Thomas Duncan's family said that he had been showing signs of improvement in recent days, but in the end it was not enough. Dallas's mayor reassured the public that healthcare professionals will stop the Ebola virus in its tracks.
And the fear of Ebola spreading has the U.S. on high alert. From airports to first responders and hospitals, everyone on the front lines of possibly seeing the disease, making sure they're ready.
KRDO News Channel 13's Rena Novini joins us live outside Memorial Hospital with tonight's big story. And Rena, Memorial staff is all trained on this and knows what to do should Ebola show up here.
Yeah, that's right, Heather and James. Staff here will ask travel questions to patients to see if they've been to West Africa or if they've come in contact with someone with Ebola. It's the same directive that the CDC is now aiming towards major airports and first responders.
They're the nation's largest ambulance provider, so odds are if someone has Ebola in the U.S., AMR paramedics will be among the first to come in contact with them.
We have increased our protocols. We're paying a more heightened attention to the recent outbreak of Ebola.
But Douglas Moore, an AMR EMT in Colorado Springs, says this is the kind of thing they're trained to do, not just for Ebola.
We are unaware of what a patient may have when we respond to them, what kind of communicable disease.
If there are any red flags, all AMR paramedics have a personal protection system ready to go.
So the mask that covers the face and the eyes, the gown for the entire body.
Airports are also getting ready. 5 of the busiest U.S. airports, where more than 90% of travelers from West Africa enter the U.S., have new procedures.
Through a non-contact thermometer, we're going to be taking the temperatures of every passenger that comes from one of the 3 affected countries.
But there's some concern on if the technology and questionnaires will really track down Ebola.
If they live in that part of the world, they're dealing with a terrible crisis, and they are going to do whatever they have to do to get out of that situation, which means that, yeah, they may try to cheat the system or otherwise game the system to get out of those infected regions and come to an area like the USA.
Still, experts say the risk of Ebola spreading from person to person in the U.S. is slim. The biggest battle will be at the borders because disease doesn't need a passport. In Colorado Springs, Rena Novini, KRDO News Channel 13.
Thanks, Rana. And a reminder, Ebola is not an airborne disease. It is only transmitted through bodily fluids.